COVID-19 hit a lot of communities hard, especially Southeast Raleigh.
Infection rates, hospitalization, and death. This is one of the top zip codes across the state that was hit.
The COVID-19 vaccines were hoping to change that. However, ECU Brody School of Medicine graduate Dr. Rashida Monroe, who works for Wake Med, noticed something early on in the vaccination process.
I didn't see any people of color represented, and we were vaccinating over 1,000 people that day.
We knew based on hesitancy data that there was a big distrust of government, a lot of misinformation about what COVID was, even denial that COVID even existed.
So Dr. Monroe decided to do something about it. She started talking with health officials and her now named Sister Circle.
We're 6 African-American female physicians here at Wake Med. We started a social media campaign to show ourselves getting vaccinated.
And that was just the start of it. Dr. Monroe and the Sister Circle were then connected with area pastors.
In this community, folks trust their pastors. They trust their black doctors.
The church is a safe place for people.
And then we started seeing folks flocking to the churches.
She held logistical meetings with all of the pastors, making sure we were serving as many people as we possibly could.
When we provided that bridge and that opportunity for access, people were willing, thrilled, and excited to get vaccinated.
The numbers kept increasing.
We had a line around the building of individuals who just wanted to get on the waiting list.
At this point, we were doing every Saturday, getting thousands of folks vaccinated, running multiple sites.
She was not a hands-off kind of leader. She was vaccinating, she was talking to folks in the waiting area.
Building the rapport and the relationships was everything.
Dr. Monroe's personal touch also came through in many ways. Edrisa Horton was a volunteer at one of the vaccine clinics, but wasn't planning on getting vaccinated, even when a shot was offered to her.
I said, well, I'm 50 and healthy. And she says, right, but we want to continue keeping you 50 and healthy. And it didn't take too long for me to decide to go ahead and get vaccinated.
We saw that story play out over and over. When they'd have access to a physician who sat down and took the time to do that with them, 9 times out of 10, they were ready to get vaccinated.
The vaccination success with Dr. Monroe and the Sister Circle even got the attention of President Joe Biden.
We can plan a vaccine clinic today, and it would be very difficult to get someone to receive the vaccine. And the only reason why is because we've saturated the community.
That vaccination work wouldn't have happened without the Sister Circle, with Dr. Rashida leading that work.
One of the things that we talk about with the Sister Circle is that it's a shame that honestly this is such a big deal, because this should be standard. It kind of puts a spotlight on the fact that we've got so much more work to do to build health equity in this community and country. So it certainly is an honor to receive the recognition, but I wish it weren't such a story.